All right, everybody, Dr. Moser here. Thank you for tuning in today. Hopefully you can hear me. I'll wait for Raul to pop on here, but we're going to be doing a joint live again today. Obviously, I love doing these with other people because I don't just like to hear my own voice. I like to bounce ideas off of everyone. So basically what we're going to be talking about today is going to be birth control and weight loss. And for those of you who do not know, Raul works with HiFit, and he's been on the show before. He works with HiFit and he works with competitors. So he reached out, I think last week, and was talking to me about birth control, and he kind of got upset, got all worked up about it, and I got excited to be able to do this live with him. So just waiting for him to jump on here right quick. So Raul, when you jump on, just go ahead and say what's up and see if you can hear me. If you can't hear me, then I just wasted an introduction. Raul keeps popping on and off, I think. So, all right, let me just double check here and see if we have anybody else on. Wait for it. Okay, get that going. All right, it's always awkward starting off here, huh? We'll trim this video down once we post it on YouTube too, so it doesn't look terrible. Okay. So I'll just start rambling on then. So one of the main things that he was talking about is when he's doing competitors, he's working with competitors, obviously when they're stepping on stage, you want to have the fittest physique possible. And so if you're using a birth control, one of the number one side effects of being on a birth control medication is that you do have unexplained weight gain. An example that I always will remember is when birth control started to come out back when I was in I think it was going into high school, so it started to get really popular. And there's a girl that we went to school with that was all of a sudden put on birth control and went from a very skinny physique to a very rather large physique. And they needed to put her on birth control to keep her hormones activated the way that they wanted to, or controlled the way that they wanted to. But that was one of the things that I noticed. And so back then I was like, holy smokes, like, okay, so there has to be something, there's some sort of correlation to birth control and weight gain. So Raul just popped on here, so I see he's watching. So I'm gonna go ahead and try to invite you to come on here, Raul. So let me know, make sure you're while you're using your laptop, so you should be good. But I'm trying to just make sure we add here. Good. All right, just taking 1 second to be able to allow me to add you there, Raul. But anyways, yeah, so she had blown up from a very small physique to a rather large physique. And so when Raul was trying to get people dieted down for shows, if they can't lose that pesky fat, Raul becomes honest with them because he knows the biochemistry of the body, he knows how hormones work. And so he's like, you know what, you're not going to be able to be as lean as you'd like to be with dealing with birth control. So once he's activated on this, Raul, you might have to switch to your phone, brother. Because I don't know why it's not letting me add you on there. So if you can pop on your phone and just have it in the horizontal view, that would work. Or I actually gave the option to be able to allow you to jump on and ask to be a guest speaker or a guest person on this show or on the live here. So trying to keep it under 5 minutes, but of course we always have technical difficulties because that's just how it is. So while we're waiting on that, thank you, Lauren, for popping on here. I'm on a cleanse day, by the way, which is okay. Waiting for it. Says it's adding, so I'm excited. Okay. Going to start to think that it's something on my end if Raul can't jump on here. So. Let's see what we got here. There we go.
All right, dude.
Perfect, brother.
I swear we cannot do this on my laptop.
Is that what it was? Your laptop said no?
And it just never popped up. Like, it never invited me. So I had to basically swap the little thing on my phone so I can plug in the headphones from my laptop to my cell phone. Anyways, man. So what's going on, dude?
Not too much, brother. I tried to do a little bit of a preface, but I have a feeling we're just going to end up trimming off that front part. So we'll just pretend like that never happened. I know Lauren was on here, and you were on there for a little bit there too. But So yeah, so the gist of it here is that you reached out like last week or the week before, and you were talking to me about birth control and competitors. So what has your experience been with birth control competitors? What have you seen?
It's a very frustrating thing, man, because I'll have clients that come to me who are already taking birth control, who I haven't necessarily had the time to teach them, about birth control, and it's the hardest thing to me because I don't want to tell them, like, hey, come off birth control. Like, it's like no liabilities, but can you please come off birth control, And especially when you have someone who's been on birth control since they were 15, 16, and they're
Yep.
in their 30s, it's like, that's a tough one.
Hmm.
But yeah, man, out of all the people that I prepped, I've never had a female competitor who has been on birth control leaning off on stage. I just cannot, like, through nutrition, exercise, supplementation, I just cannot get them leaning off when they're on birth control. And you're fighting a drug and
Hmm.
hormones at the end of the day, a drug that's regulating hormones. And you very well, I mean, you're the hormone king. You
Yeah.
hormones, you can't fight.
Yeah.
And know when there are drugs involved.
Hmm.
So it's definitely a tough one. Once I'm coaching them and they say, hey, I'm gonna get on birth control, or hey, I just got on birth control. That's the worst text I get. It's like crap. Like, okay,
It's like we're
well,
gonna have to back your show date back a little bit here.
that, or could you come off birth control? Just give me like 2 more months, 3 more months, or
Yeah.
whatever. And
Hmm.
honestly, man, a lot of people, it's a funny butterfly effect because a lot of girls will take birth control because they're dealing with acne.
Yeah.
So and birth control helps them with the acne, which is true in a way, but it's almost like you're creating this catastrophic event in your body because your hormones are out of control. So you're adding more and more and more. You're just piling it up.
Hmm.
It's definitely a frustrating thing. I mean, coming off birth control, what do you? How long do you think it usually takes to kind of regulate hormones wise?
It depends, man. I mean, realistically, like from my experience, and I know a lot of our other docs we work with and their experience, everyone's different. But the
Mm,
longer you're on it, the more you can kind of suppress your body's natural production of hormones. Because ultimately, you're
mm,
putting in synthetic regulations. And so what can happen over time is we're working with, I don't want to go too nerdy, but you know this stuff. So luteinizing hormone and follicle stimulating hormone, those are your main things that allow you to cycle properly. And it's also responsible for you creating hormones. Okay.
mm-hmm.
So for your reproductive organs to produce hormones. So the longer you're on it, the more you suppress it, the longer it can sometimes take to reactivate those signals to get your body to
Yeah.
come back to normal. Because you're basically saying, like, just if a guy was on like testosterone,
I was gonna say
you
it's a
get put
guy
on
on
testosterone, it's
TRT.
the same thing. Yeah, yeah,
It's a guy on
exactly. So
TRT.
your body's
Absolutely.
just like, I don't need to produce this anymore because you're giving it to me. So it's like that negative
Yeah.
feedback loop where there's a ton over here.
Yeah.
So our body's like, no, we don't need that. I'm getting it from an outside source. So I mean,
I,
I've
I'll,
had,
I'll
go ahead.
go ahead. I'll
No.
tell you, man. I've had to do sometimes, like, introduce them
Yeah.
with some of the girls. Used to almost it never fully cancels out the birth control because we're talking about herbs versus chemicals.
Hmm.
But I've used it before just to kind of get them a kickstart if they're coming off the birth control, which I feel like usually if they've only been on it for 2 to 3 years, it's about 3 months or so is what I've noticed.
Hmm.
Just from, there's no studies behind this. It's just from my personal experience working with people. But it's about 2, 3 months. And the DIM kind of spits it up. If they're on birth control, when I'm trying to lean them down and once again, estrogen is the complete. You don't want high estrogen when you're trying to cut down. It's the complete opposite of what you want.
Hmm.
Um, Anyways, the DIM tends to bring it down a notch to where it allows me to just kind of tap in a little bit more into the thicker, more fibers, fat cells. Once again, you're still dealing with the chemicals.
Hmm.
So
Yeah, for
let
sure. I
me
mean, go ahead.
go ahead.
I was
We
just gonna
keep
say
going back and
at the
forth.
end of the day, I mean, you're taking the medication. Medications force your body to do whatever it is that it needs
Hmm.
to do. That like we joke around and use the example. Like if I gave you a little blue pill of Viagra and I gave that to you, like
you're going to have to walk around with a towel down below just to make sure. I mean,
For
because it
sure.
forces your body to work or to do
Absolutely.
what it's intended to. So like,
Absolutely.
we were joking around before. It's like you're taking an herbal or a supplement to try to counteract something that you're forcing your body to do. So
Yeah.
it's like you just keep putting on more and more layers, and your body's like, what the hell is going on? You're telling me to do this, you're giving me this, and then you're putting this in the body. So what,
Yeah.
what am I supposed to even be doing right now? So that's why, yeah, I mean, it's basically impossible for you to lean out if you're going to be on that birth control, especially coming from a competitor standpoint.
Dude, you do a lot of blood work, a lot of blood testing, and some of my clients also, I've sent to you for blood work since I believe that the one that you have is probably as extensive as blood work's ever going to get. Girls that are on birth control, anything that you notice differently than from your typical non-birth controlled female when it comes to blood work?
Yeah, it depends on what form that you're going to be taking. I mean, you can have like your IUDs, you can have, now they're doing injections. They have all kinds of different things that they can put into your body.
Yeah.
And I'll be honest with you,
Pellets.
the majority of it, yeah, pellets. Oh my gosh, this is one of the most unsafe things in the world. Like, oops, I got cancer. Oh, we can't take the pellets out.
We
Whoopsies.
can't take it out. Sucks for you.
Yeah, yeah. Enjoy your cancer.
Yeah.
But I mean, I'll be honest.
Have a good fight.
One of the most, yeah, you're losing. But it wasn't our fault.
Like,
Whoops.
Right. It's like, let me wash my hands off right quick. Yeah.
Yeah. But honestly, what I see, and we kind of talked about it before, is I will actually see the majority of it, as long as you're taking like your typical birth controls, I'll see a lot of levels down in the postmenopausal level. Okay.
Mm-hmm.
And the reason that is just like what we talked about, is that your body is going to be shutting down the normal signals to produce those normal hormones. So sometimes those synthetics don't actually get picked up on certain testing, whether it's a urinalysis, you can do urine, you can do saliva, you can do blood. Sometimes blood will show a little bit more, just like if somebody cranks up their testosterone. I mean, you're going to see if you're taking massive estrogens, and boom, your estrogen is going to be through the roof. But usually it's going to be your E2, your estradiol, that's going to be pushed up or suppressed down.
Yeah.
But then the other thing too that's not healthy with you is if you're not cycling, I mean, like doing like your normal reproductive cycle, if you're not having that happen, if you're not getting rid of those eggs and you're not going through the normal process, the normal biology, you're screwing your body up tremendously,
And having your cycle is a huge factor, or it's a huge indicator, of hormonal health. If a girl's not having her cycle like scheduled, basically, there's something that's throwing it off. And there are many ways of fixing that. Birth control is definitely not one. So, I was going to ask you, when it comes to side effects, obviously anybody can Google birth control side effects, and you're honestly going to get them all. I mean, truthfully, or 99% of them. Now, you've mentioned how you've seen a correlation somewhat between girls who are on birth control and menopausal women. Do you think that is the birth control just kind of throwing their bodies into that? Like, I don't feel like someone who's in their 20s and 30s should be going through such symptoms. The heat flashes, the up and downs, and I mean, truthfully, I don't think even if you're in your 40s and 50s, you should be going through menopause as heavy as anybody, as most people actually make it be. And it's just, once again, it's just the hormones being off. And there's a lot of factors that, go in there too, obviously, as what's throwing them off. But
do you have a question attached to that?
I halfway answered the question that I was going to ask you.
Yeah. So what you're talking about is like, is that healthy to push somebody into that menopausal state? And it's absolutely no. Especially, like, again, you have to have those normal biological processes. But when you have like the symptoms of the hot flashes, or you're angry, or you go through all these different phases of menopause, they've labeled menopause more or less as an illness, but it's a natural biological process that your body has to go through. Absolutely. And when you go into that transition, the big thing that you should notice of that age, the average age of menopause is about 51, give or take, once you get to that phase, all you should really notice is that your cycle goes away. Okay, so if we early induce these women into having menopausal symptoms or going into menopause, especially in their 20s, that's not good. That's not healthy. No way.
Doc, what do you recommend for someone who's in their 30s or 40s and they're having not being on birth control and they're having menopausal symptoms?
Oh, if they're not on birth control and they have menopausal symptoms, Lord help
And
them.
I see it a lot from my personal clients. Like,
Yeah. Well, that's usually why a lot of people get put on birth controls. They'll have really painful periods or really painful cycles, or they'll have acne. They'll have something going on that is hormonal
yeah,
that their body is trying to counteract. So, I mean,
start with blood work.
Yeah, the number one thing to do, yeah, for sure, do some blood work, do some, the Dutch Complete test is fantastic, especially for women. Going through that phase, doing a Dutch Complete is massively important. It's the urine test. You capture your cycle around like days 19 through 21 to get the most accurate representation. But the reason why I really like the Dutch Complete is that you get the 4-point cortisol attached to that. So a lot of women don't know that, especially, and this goes into infertility. I actually talked about this last night at my softball game I was at. But when you're stressed out all the time, what's going to happen is that progesterone is going to convert into cortisol, going to convert into cortisone. So you're going to go into draining your progesterone tank, so that your cycle is going to drop down. If your progesterone goes down, then you become estrogen dominant, and you have all kinds of symptoms of estrogen dominance, painful cramping, heavy bleeding, emotional around the cycle, crazy cravings, mood swings. Oh, for sure. Weight gain. You can gain 15, 20 pounds of water weight around that estrogen cycle around week 1 and week 4, and that's just from that estrogen surge. So,
and the higher cortisol doesn't help either with the weight gain.
No, not at all. And sometimes that cortisol can actually get stored in the fat cells. So if you're stressed out, then you get more fat gain. Then you eat more. Then that converts more of your testosterone to estrogen, and then more fat. And then it's just
you go into that little cycle, man, and it just gets worse and worse and worse unless you truly like snap out of it.
Exactly.
So for someone who, 2 recommendations for someone who has been on birth control. Do you usually recommend? Is there a better way to come off birth control or a safer way? And then also someone who's wanting to get on birth control for non-birth control reasons, because of acne or just balancing hormones or super heavy on the PMS inside. Like, what do you recommend for them?
So same thing is going to be running through the test and figuring out why their body's responding the way that it is. If you're going to get put on a birth control medication or pill and it does work, then you know that you have some sort of hormonal imbalance, because birth control is basically hormonal. So people who want to get on it for non-birth control reasons, which is basically it's over prescribing now. It was designed for preventing babies, pregnancies, but now it's getting used for anything: headaches, migraines, heavy bleeding, painful cramps, all that stuff. So I don't ever really recommend for people to get on it, but if they do and they want to come off, then there's no, like, I can't as a chiropractor tell anyone to get off or on any medication. You can cold turkey that stuff, and then eventually I usually tell my women to wait about a month or so to let the hormones recalibrate, because who knows? I mean, some people might be able to get their cycle back real quick. And so I don't want to get an inaccurate representation of what those hormones are, because you're going to be tapering down, or you could be tapering back up. So I want to snap that picture about 4 to 6 weeks after you're done with the birth control, see where your hormones are at, and then we could do some symptom-based stuff in the meantime. But really, I have to see what's going on in the test to figure out why you're put on birth control and what we can do to fix that naturally without side effects.
Absolutely. And a lot of times some of the reasons why people do want to come on birth control outside of birth control itself is actually it can be fixed through nutrition and lifestyle. I mean, truthfully, probably 99.9% of it could be done that way, and as well as obviously making sure that you don't have any crazy subluxations going on, that you're getting adjusted regularly, and just keeping your body in full balance. When it comes to birth control, why the $1 million question? Why are these doctors pushing it so hard? and I like to say money. But I'll let you speak
I mean, I can't see any reason other than money. You know, when you have like, I mean, really, like when you're talking about medications, you basically have like a pipeline of like symptoms. So say you're coming in for originally you're like, hey, I just don't want to get pregnant. You know, birth control was illegal up until just like not even like 100 years ago, like 50 some years ago,
I was not
and
aware of
it
that.
wasn't supposed.
Wow.
Yeah, it wasn't supposed to be legalized because of basically like for discretion. So they were thinking that people were going to get put on birth control and then they were just going to go on a sex spree and that nobody wanted to get pregnant. So they didn't want women to turn out like that. So they were like, no, we don't want to do it. And then it got overturned and then they started using the pill and then they've created, you know, I mean, there's anything you can think of,
Sure.
injections,
Oh,
everything.
yeah.
So the only thing that I can think of is there is a specific medication or simple,
Monetary.
yeah, and to start spreading it out and be like, oh, well, it helped her with her acne, so I'm going to give her birth control. Or I'm going to help with it. Birth control, it can help with all those symptoms. Don't get me wrong, but
Yeah.
if you're taking it and you do have resolution of those symptoms, it's because you did have a hormonal issue to begin with. But then there's also people who get on birth control and nothing changes. Well, why is that?
Sure.
Well, you could have a gut infection or you could have massive inflammation in there and you're pushing stuff out through your skin.
Absolutely.
So there's a lot of different things, but I think it all ultimately comes down to money because you can just get just a one size
Easy.
fits all. Everyone, it's like Oprah, you
Easy.
get birth control, you get birth control, you get birth control. But it doesn't help,
No.
you know,
Yeah.
it doesn't, in the long run, it's not healthy and it's not sustainable. No way, no how.
Yeah. No, I agree. And once again, it's a hormone, guys. Like it's not just a little herb that you can take in or a pre-workout that goes away. You know, like it's
It
something
doesn't wear
that
off immediately.
right. I mean, you're talking about it's something that you can take a pill and be dealing with it for months after. You
Hmm.
know, so I would say just be a little bit smart. Do your research. If you're on birth control, maybe talking to maybe a different type of doctor, a naturopathic. Chiropractors are you guys legally able to um, I guess coach, 'cause for lack of a to stay on the legal side, people when it comes to or patients when it comes to being on hormones or somewhat
Yeah,
out of the scope.
well,
Yeah, I mean
100%. Yeah, I
you
mean,
can do recommendations.
yeah, oh, for sure. And
Yeah,
that's what we do is like,
yeah,
you know, if I feel like it's medical malpractice if you go into a doctor's office
I
and
like
they
that. Yeah,
choose to put you on birth control, a hormonal birth control, and they never first test your hormones. Okay, because I see this all the time.
yeah,
Because if you're giving someone hormones, you're
yeah,
assuming that they have a hormonal issue, and
yeah.
you're assuming that it's going to be
You're not
beneficial for them.
testing.
But
You're not testing.
no, they're
Yeah.
not. They're not at all. And I had one of our docs we work with, Dr. Jeremy Maxwell, had a patient that he showed me this girl's hormone test. She actually had she was taking bioidenticals. She was I
Hmm.
think she was 72,
Hmm.
postmenopausal, supposed to be postmenopausal. And her estrogen arrows were red on all of the Dutch tests, and she basically got breast cancer in like I think it was 7 months
Oh,
of
lovely.
using this estrogen cream. And then he asked the basic question is, did they test your hormone levels before they put you on this stuff?
Pure
No, they didn't.
assumptions. Wow.
Yeah, so it's such a it's man, it ticks me
Yeah.
off that when you say like, hey, you might have to spend a little extra money just to get tested, just to make sure we're doing the right thing, versus a doctor's like, just take this and we'll see what happens.
And for those that don't know, whenever you have cancer, breast cancer, for example, one of the drugs that they give you is tamoxifen, Nolvadex, which actually lowers your estrogen. There's a reason they're wanting to lower your estrogen. When you take birth control, it raises your estrogen. So you're pro-cancer. You're in an environment that's allowing cancer to do its best, basically. So um, do your homework, everyone. That's all
Well,
I'm gonna say. Once again,
I have to interject on that real quick, okay?
bring it.
Did you know that tamoxifen is a known human carcinogen?
Oh shoot!
Causes cancer. Okay?
This just
So
got great.
yeah, so it's the number one prescribed aromatase inhibitor for people with breast cancer.
Yeah.
Okay? Has a great track record, but here's why. It blocks the estrogen receptors on the breast cancer cells in the actual breast tissue,
Yep.
deflects them down to the reproductive organs.
Oh,
Gives you
lovely.
cancer down below instead of cancer up here.
So you're just moving the stuff around, basically.
Yep. Yep. It's like you're
Wow.
playing ping pong and just smacking the estrogen down to the reproductive organs. Yep. And then it can
Holy.
recirculate, it can metastasize everywhere. Yeah. No
Wow,
carcinogen,
man.
and that's
You're,
one of the top prescribed medications out there.
you're a wealth of knowledge, dude. That's insane. That's insane.
Yeah, yeah. So
I'm impressed. I'm definitely gonna be stealing that line from you.
it's the truth, man. You could look it
Yeah,
up.
that's
It's on
crazy,
the
dude.
American Cancer Society website. I was going through it the other day. I'm like, what the hell? Like, I knew it causes cancer, but they literally admit that it's a known human carcinogen. It's not even debatable. It's on the list that it
It's like
causes it.
what happened with DIM and calcium deglutinate and all of those guys? You know, like
Yeah, yeah. Or
oh, they
passion
can't
flower.
make
It's
they
a
can't
aromatase
pharmaceutical
inhibitor.
companies
Like,
can't make money on it though. That's what it is. Yeah, madness, dude. Anyways, I appreciate you taking the time to do the live with me, man. And I know we have a lot of topics that we're wanting to cover.
yeah.
I have a list, so I'm pretty excited,
Cool.
and hopefully we can get people to understand a little bit more
Yeah.
what you and I get to deal with. Me more so, and in terms of the nutrition and fat loss perspective, and then obviously you more so from the overall hormonal true health and maximizing everyone's potential when it comes to health. So
Yep. So cool.
awesome, dude. I
So
appreciate
let's
it,
end it
man. Thank
before
you
we
so
keep
much.
talking.
Yeah, no,
All
hey,
right,
hey,
brother.
where for my followers, where can people find you?
Oh, for me, Structured Chiropractic, the Wellness Way in Pittsburgh. You can go on YouTube. We're at Structured Chiropractic on YouTube, and then Structured Chiropractic on Instagram as well. You can find
Perfect.
me anywhere. Yeah,
And I'll go ahead and put those links too when I post the video.
cool,
So,
brother. All right,
all right, thanks, brother. Appreciate you, man.
you bet. Take care. Bye, man.
Bye bye.